my name is Greg Medlock, and I'm a Senior Director in Research and Development at Vedanta Biosciences. And today I'll be telling you about VE707, which is a preclinical stage product that we are developing for prevention of infection by gram-negative bacteria that have antimicrobial resistance of concern. So Vedanta develops a class of drugs called defined bacterial consortia. And these are drugs that are produced starting from pure cell banks of bacteria that are then grown and formulated for oral delivery in capsules. And our goal in our anti-infectives program is to focus on the needs of patients at very high risk of infection who are either undergoing procedures like solid organ or stem cell transplant or suffer from recurrent infections. We take those patients who are currently experiencing a high antibiotic pressure that's leading to damage in their microbiome that makes them very susceptible to outgrowth of pathogens. And we provide our drugs that are tailored to provide protection against growth and active virulence of those pathogens. The hope being that that will go on to decrease the likelihood of infection or recurrent infection. For VE707, we've designed the consortia of bacteria to specifically have activity against E. coli and Klebsiella pneumoniae strains with carbapenem resistance and production of ESBL. To design this consortia, we first started from human FMT donor material. So these are fecal microbiota transplant donors who participated in a study for prevention of infectious diseases. Using this material, we performed ex vivo screening against our pathogens of interest from the stool, and then we also performed mouse experiments where we were trying to observe which donors decolonized pathogens from mouse stool most effectively. After that screening, we isolated thousands of individual strains from the stool samples and evaluated the individual strain activity in competition assays against our target pathogens of interest. So using a combination of solid agar media screening and broth competition, we could understand the direct mechanisms of interaction between our target pathogens and our strains. So we used an iterative process of in vitro and then in vivo screening in a decolonization model to design defined consortia to evaluate. And VE707 is the strongest performing consortia out of 94 that we evaluated in a mouse model of decolonization of Klebsiella pneumoniae and E. coli. Once we selected VE707 as the candidate, we expanded out our in vitro testing to include a panel of globally distributed, highly prevalent, multi-drug resistant E. coli and Klebsiella strains and demonstrated that VE707 is able to inhibit growth and compete with these species in a non-strain specific manner, suggesting that it will have a broad spectrum of activity. And lastly, we started with the cost of goods of this drug in mind from the beginning. And we've been working on innovative manufacturing processes such as co-culture fermentation to control our cost of goods for a very complex bacterial consortia like this. So we've developed these co-culture processes where strains are optimally combined to optimize their overall yield in production. And we've shown that the drug produced via co-culture retains equivalent decolonization activity as the drug assembled through monocultures. And we're now engaged in GMP manufacture to support our first human clinical study, which we are planning in conjunction with Carbex. And we'd like to thank Carbex for supporting this work.